I'm
first?
Nurse Butler.
This is the Health Science Technical Education Program, and I'm Casey Wilson.
And I'm Beverly Land.
And we teach our students vital signs, and we teach them basic nursing skills. And most of these students in here today are first-year students, and so we're just getting to the good stuff, getting into the lab and teaching them.
They learn history of healthcare, they learn infection control, they learn some dental assistant skills for the second-year students, physical therapy skills, lab assistant skills, nursing assistant skills. Safety for first-year students.
CPR.
And we also have a program that we use on the internet. It is Health Center 21, and it teaches, or they could get certified in medical office assisting. So when they're finished with our programs after the 2 years, they can take the test over on the main campus through the Learning Center and be certified medical office assistant.
So conceivably actually go into the workforce after they finish this program.
True.
Okay. So you want to tell me what you're doing here?
Checking her pulse and taking her blood pressure.
Thank you, doctor.
So tell me, is that a normal blood pressure?
Yeah, for her age, it's normal.
For her age?
She's 17.
What was her blood pressure?
103/61.
Can you tell me again?
103/61.
103/61. And what would be like an irregular blood pressure for somebody 17?
If it was, the top number was really low, then it would be irregular.
What's the top number called?
I told you guys. Yeah. We do it. Well, this woman done jank. Be quiet.
Good job. 119/75.
And what was it again? Is it?
119/75.
And that's normal?
Yes.
And how old are you?
18.
For someone who's 18, that's a normal blood pressure? Okay.
Good. I want to be a neonatologist.
What's a neonatologist?
A premature baby doctor.
I'm Mallory, Caldwell, and I want to be a child psychiatrist.
And what made you decide to get into this program?
Because I thought it would help, since a psychiatrist has to go to medical school to get its license.
Until you hear the
Well, no, you have to get it, you have to pump the blood pressure cuff up, and then you start slowly releasing, and after you start slowly releasing is when you start hearing the beeps.
and then that's when you count the time.
Well, you don't count, you just look at it and read
yeah.
it. Whenever you hear the first beat, that's going to be the top number, and the last beat that you hear will be the bottom number. Okay, and what is the top number called?
And then it's
Systolic, and the bottom number's called?
systolic.
That's it.
Okay.
Good job. People sometimes get, especially if they have blood pressure problems, they will get
I'm going to take your temperature today.
and they'll have them sit up inside of that for 2 minutes, and then they'll be sitting, and then they'll have them stand up and do the same. So you've got 3 different ways of checking blood pressure.
Okay, I'm going to place this in your spoon.
While you're waiting on that, check the pulse. And how long are you going to
Toward the inner, or over here.
96.8.
And what's normal, Jessica?
97.
You're getting me to
You're getting me
If
to
something happens, you're gonna wait a few minutes to check it, because it will alter their blood pressure just by
That's
inflating.
95.
Are all those normal vital signs that you're seeing there?
Her temperature was a little low. Her vital sign on her pulse was all right.
Her pulse was all right because normal is, you remember that range? It's 60 to 100. That's right.
What could
She's
a
an athlete, so
She's an athlete, and so what does that mean?
it'll be high.
It might would be a little bit lower for her, and that's okay. Because her heart is conditioned and it.
Are you cold? Cover you up.
what would a slightly lower temperature might be? What might be that indicative of?
A while ago it was 96.1, so that was a little low.
What could that mean?
Oh, okay. Well, she could have the flu.
I could have done something cold too.
Yeah. She could have ate something.
Did you ask her before you took her temperature when the last time was?
She drank some water
So we should have checked her temperature where?
under her arm.
Under her arm, right? Okay.
Or
Uh-uh.
just tell him where else you can check it.
In her rear end,
And that is called a, what kind of?
her rectal.
Rectal temperature, that's right.
What about, you see a lot now about foreheads, about taking temperatures of foreheads.
And we don't have one of the temporal thermometers, but yes, those are popular in doctor's offices. It's the best way with children to take their temperature these days.
Or her ear.
Or your ear. So what have you learned since you're a second-year student? What have you learned in your couple of years in
I've
this
learned
program?
medical math, blood pressure, and all the vital signs. We're working on phlebotomy right now. CPR, we've learned that.
Do you have goals of going into the medical field,
I wanna
like
be
as a
a
career?
pediatrician.
I think I want to be I'm not sure what I want to be, but something in the medical field. There's a lot of different careers we learned about in Miss Wilson's class, and in Miss Land's class we learned about anatomy last year, and the anatomy, it interested me a lot more than the clinicals and stuff.